a functional vision assessment should answer the question, how does the student's visual impairment come between them and the curriculum, or what a typically developing student would be exposed to? So the functional is going to answer the question regardless if the origin of the visual impairment is brain-based or ocular-based. A good functional is going to consider, would brain-based strategies benefit this kiddo even if CVI is not explicitly listed? So kind of a screener, like would this student benefit from maybe simplified presentation of two-dimensional objects so that they are not having to try so hard just to look, right? And so a good functional will consider that maybe CVI strategies would benefit that student, even if it's not explicitly listed under the diagnoses. Um, but we do have several tools that we like to see when we see a good functional in the company. One of those is the Perkins CVI protocol. It is, fairly new, but it has been rigorously tested before its launch. And what you're looking at is a breakdown of like a constellation of different characteristics where a student might have all, 16 of these characteristics presenting themselves, maybe severely, but or maybe they would have just a portion of those and they may be mild to severe. A good assessment is kind of going to suss out how severe each one of those characteristics is, because a student who maybe is like really with it, and maybe when they're in kindergarten, you're not going to see the effects of CVI as much. A good assessment is going to say, hey, this student really has trouble moving their eyes, from the upper field to lower field. And if you're trying to complete math equations, like do long division, right, then you might see some frustration around the math class that might be due to comprehension. It might be due to eye fatigue because they just have had, recess, or it might be because that ocular movement of upper to lower field is just incredibly hard for this student given their unique presentation of CVI. So all that to say, a good functional is going to consider ocular and potentially the visual processing piece. It's going to break it down into these characteristics. You may see the Roman Lancy that's still out there. That's a certain set of characteristics. The Dr. Amanda Lewick is a different kind of set of characteristics. And now the CVI protocol, which is the 16 characteristics. It's essentially trying to break a very complex constellation of presentation that you could see with CVI down into something that is manageable for the team to understand and then attack with specific goals.